So thank you for asking. So 𝐬𝐵 peritoni is a rare cancer which affects the peritoneum. So before discussing about the cancer per se, I'd like to discuss about what is peritoneum. So peritoneum is a thin flimsy layer which covers the abdominal organs, intra-abdominal organs, and also the abdominal wall. And the cancer affecting it is called a peritoneal cancer. So 𝐬𝐵 peritoni is a peritoneal cancer which affects the peritoneum. So it largely arises from the appendix, and the peculiar thing about this cancer is that it produces a lot of mucin. It produces a lot of jelly. So mucin is a jelly which forms inside the abdomen, and it fills the entire abdomen. So now it becomes a difficult to treat disease because nothing works. No chemotherapy works, and also no radiation therapy works. So this is the reason we need to know about this rare disease, which technically speaking is a stage 4 cancer but potentially curable. So the symptoms of 𝐬𝐵 peritoni is very vague. The patient generally have bloating sensation, indigestion, distension of the abdomen. The abdomen becomes very big. So you have to understand that these cancer cells, they produce a lot of mucin, they produce a lot of jelly which fill the abdomen. And because of this a large amount of mucin, the abdomen becomes big, and this also compresses the intestine and the stomach. So the patient loses interest in eating, there is loss of appetite, which results in also loss of weight. So the symptoms are not very classical, very clear cut. That is the reason you should be aware of the symptoms. You should listen to your body, and if any symptom which is abnormal and persistent, that is the time you should consult your doctor, you should consult your oncologist, so that you are diagnosed correctly and treated correctly. Because in cancer, everything depends on correct diagnosis and correct treatment. So if we talk about 𝐬𝐵 peritoni, these patients are stage 4 patients. So in stage 4 patient, now cure is possible. So if we talk about a decade ago, these cancers were incurable. But with development in medical science, now we have a technology, we have a surgery, we have a surgical cure for these patients. So there is a surgery which is called cytoreductive surgery, popularly called CRS and HIPEC. So this is a 2-stage surgery. So first step is a good surgery where all the disease which is visible to the eyes, all the macroscopic disease is removed surgically. The second step is HIPEC, where heated chemotherapy is instilled into the abdomen directly, which takes care of the microscopic disease, which results in good control and cure. So now from a stage 4 incurable disease, we have moved towards a potentially curable disease. If I talk about the outcomes are really good. So in cancer, we always talk in terms of survival. So the 3-year survival for these kind of patients is in the range of 70 to 80%. Majority of the patients are cured of the cancer, and they are cancer winners.